Today, we complain about things like traffic, slow Wi-Fi, the DMV, the algorithm not pushing our content. But imagine living in a world where simply surviving childhood wasn't guaranteed. People didn't ask if cholera was coming. They asked whose house was it going to visit next. Typhus, cholera, tuberculosis, dysentery. Disease wasn't unusual. Death wasn't unusual. But making it to adulthood was. The part that stands out so much to me is that people actually believed that disease and death was a curse, or that getting disease was just a part of life and to expect it. Now, I want you to close your eyes. Imagine opening your front door. The streets are muddy, except it isn't just mud. Open drains run beside the road. Waste collects in cesspools beneath the homes. Some families literally slept above pits filled with human waste. The smell? Well, people described it as unbearable. Today, we would call it a public health emergency. Back then, it was just a Tuesday. And then a man came around and he started asking all the right questions. What if people weren't cursed? What if they weren't just unlucky? What if their environment was killing them? Meet Edwin Chadwick. He wasn't a physician, nor was he discovering something under a microscope. Chadwick was a revolutionary for his time. He followed the evidence. He interviewed the physicians. He talked to the engineer, met with the local officials. He reviewed death records. He inspected neighborhoods. He compared one town to another. He walked the streets where people were dying. And slowly a pattern emerged. Disease wasn't random. It followed poverty. It followed overcrowding. It followed standing water. It followed overflowing cesspools. It followed contaminated drinking water. Entire neighborhoods weren't dying because they were unlucky. They were dying because the conditions they were forced to live in. One of Chadwick's most powerful ideas was that disease had removable causes. Think about that for a second. Removable, not inevitable, preventable. That idea changed everything. Now here's the twist. Chadwick was wrong. Well, kind of. He believed disease spread through something called miasma, or bad air. Today, we know cholera isn't caused by bad smells. It's caused by bacteria spread through contaminated water. So, yes, his theory was wrong, but what's fascinating is his recommendations were absolutely right. He called for cleaner streets, proper sewage systems, reliable drinking water, better drainage, garbage collection, improved housing, and government responsibility for sanitation. He didn't understand germs, but he removed the conditions that allow disease to spread. Okay, sometimes you don't always have to understand everything perfectly to save lives. Those recommendations helped inspire Britain's Public Health Act of 1848. Today, underground sewer systems seem ordinary. Clean tap water feels normal. Garbage collection is expected. But then, none of those things were guaranteed. Someone actually had to convince the government that preventing disease was worth investing in. Here's something to think about. When you flush your toilet, everything disappears. You don't have to think about where it goes. You're not thinking about cholera. You're not thinking about typhoid or dysentery. Do you even know what those words are? And honestly, that's the point. Public health is most successful when you never have to think about it. But here is something that the history books don't talk about. While parts of Britain were literally drowning in sewage, some African civilizations had sophisticated sanitation systems centuries earlier. Yeah, you heard me. But we'll save that story for another public health file, because history is a lot more complicated than most of us were taught. Edwin Chadwick, he wasn't right about everything, but he was onto something. Disease isn't random. Sometimes it's built into the environments we create. Sometimes the greatest public health discoveries aren't about curing disease. Sometimes they're about preventing it in the first place.